It's lovely to see Sarah. Sarah came over to the ADAM stand in Excel. Yes, Excel. So it was really lovely, and I congratulated Sarah on being the only one that showed us her face on that chat.
Oh,
she's
brilliant.
probably cursing me now. I'm just trying to eat a sandwich in peace.
Brilliant, brilliant, brilliant. Well, welcome, Sarah and Pamela.
Fabulous.
Hi, I'm here. I'm just hiding.
It's absolutely fine. Welcome, everyone. But yes, Pat, as you said before, they come round so quick.
Well, it has, and also we've done so many other things. So we did all that stuff at the North of England show, and then at the BDIA. So Lisa and I were saying earlier, it feels like we're doing this every 5 minutes at the moment. So
it's a good job we like each other, isn't it?
Absolutely a good job we like each other, and a good job we never run out of stuff to talk about. So.
I know, good old compliance, hey? And I think compliance and HR and complaints, there's always lots of juicy topics, isn't there, for us?
Always.
But yes, welcome to our March Pat and Lisa chat. It is, like you say, we've seen each other quite a lot, and I think the shows were really great, the last couple that we've done, to see people really attending and asking really good questions.
Yes, really good.
Yeah. So many people came over to see us on the ADAM stand, and to say, look, actually, if it's okay with you, I might just kick off on one of the points that came up.
Yes, okay.
So we had this wonderful young lady that almost came skipping over to the stand, all excited, and announced that she was hoping to become a practice manager, and she's so excited. Her end goal is to become registered manager. And you know, without being negative, well, I suppose maybe I was a bit negative. I kind of looked a bit horrified, I think, because she saw this as being her, you know, her goal, and I kind of felt like I'd sort of knocked her down a little bit in a very lovely, supportive way, obviously. And I just said, why do you want to do it? You can do compliance, you can be compliant and make sure the practice is compliant without having to be a registered manager. And it did worry me, you know, this wonderful young lady who didn't understand the implications of it.
That's what I was going to ask you, really, Lisa. Do you think she understood the implications? I think I think that if you work in a compliant practice with a compliant principal, as in a principal who thinks compliance is important, and so many don't, you know, and I'm kind of speaking with my dentist hat on here, because us dentists, obviously not me included, because this is how I make my living, and it is my passion. A huge number, I'm going to say, maybe not most, dentists think compliance is a waste of time and energy and money, and why do we need to do this stuff? So I think that if the principal is like, has that kind of attitude, it would be very unwise to take up a position as registered manager, because the registered manager, as you know so well, Lisa and Jilly, has legal responsibility for the compliance in the practice. And so legal responsibility meant that if there was ever a prosecution, and heaven forbid that should be the case, then it will be the registered manager who is part of being prosecuted, not solely because somebody else will be the nominated individual, that'll be the practice owner, or the corporate body if it's as part of a corporate. So I think it's great to have an ambition to be a practice manager, great to have an ambition to be a registered manager. I think it's essential to understand what the legal implications are of it, to understand what the role involves and the responsibilities, to understand that you need to undertake a registered manager interview. Now, this young lady sounds extremely keen, and so hopefully the registered manager interview wouldn't be a sort of trial more than an interview for her. But I think that provided all of those things slot into place, so positive, supportive principal who thinks compliance is important, understands the legal implications, is confident to answer the registered manager interview questions, because you can't just be a registered manager, you have to be interviewed for it, then happy days. If some or even one of those things is missing, then unwise to take it on.
Thanks, Pat. Yeah, I think that's the thing. There's a lot of people that aren't paid or supported nearly well enough to take that role, in my opinion. But it doesn't mean to say they can't, be processing the compliance and being responsible for it, but not legally responsible for it.
Absolutely, yeah. Well, not legally responsible in another area, as in to the CQC. So I think, completely agree with you. Be the practice manager that is in charge of compliance in the practice. Be the person that does it, is in charge, that delegates tasks to other team members, because as we've said many times, compliance is a team game, not something that one person does all on their own. Then all of those things are good. And actually, I do also think that, as I mentioned, that provided you've got all the ticks in those boxes of supported principle and all the other things, so understanding the legal responsibilities, then I think it's a no-no. But if even one of those is missing, then it wouldn't be my advice for them to take that position on.
Yeah, thanks, Pat. I know Julie made a good point earlier, and Julie said, as long as I was in charge of the bank account and the rota and had all the time in the world to do what needed to be done, maybe I'd consider it, but probably not. So no, thank you. I do sometimes feel a little bit concerned about that area, and I feel like it is something that, being a practice managers association, it kind of does, it's very relevant. And
definitely. And I think a lot of practice managers are the registered manager, and certainly some of the corporates require it as part of the job. I just worry that people don't understand the legal implications that and responsibilities they're taking on, like you.
Yeah, no, absolutely. Thank you, Pat. One other thing, I know we've got something that we're going to look at. You've got a little bit of not a quiz, but a would I lie to you example that we might have.
I have, but I haven't kind of prepared them. So I tell you what I'd like to do is ask our audience here today. So one of the things I did at the North of England Dentistry Show was I gave an infection control presentation along the lines of Would I Lie to You, the television program where a celebrity makes an outrageous statement and others have to decide whether it's true or false through questioning. And so I wanted to liven up my infection control presentation. And so I did it like that, and it was really popular. If you would like that on one of these sessions, then if you could let us know or put something in the chat, then I think that would be good. I mean, people have gone over infection control over and over and over again. I thought, how can I liven it up a bit and also, just introduce a little bit of controversy. And so I think I do have a presentation and I could do it, but I think best to know that people would actually like that rather than just land it on them. So, please let us know. Please put in the chat whether you think that's a good idea or not. And I'm really happy to do that
That sounds
on another
good.
session.
I think it sounds pretty good fun, Pat, to be honest.
Okay, so
you know, like you say, we're not
Pamela's
making
voted for us.
Yeah, I know we're not making light of it because it is a serious subject, but it's finding ways, you know, also not just for us, but things we can sort of almost take back to our team to use as well.
Yeah, definitely. I think that's a really good point. And also there are some grey areas. And so I really wanted to highlight the grey areas and then see what people said. And I was really thrilled to bits, actually, that pretty much everybody was right in the things they said. But then again, you're kind of preaching to the converted, and I would be really willing to bet that people who come on our sessions here already know the answers to these things. It kind of just confirms what people think. And some of the things we talked about actually were more my personal opinion on how it should happen. And then, of course, you're risking people saying, oh, well, I don't agree with this or I don't agree with that. But none of that happened. And it was really, really popular.
That's good. It's a little bit like when I do my complaint handling training. I have this, you know, what would we like to say compared to what we should.
Oh, that's a great idea. Yeah.
It's really therapeutic. I would
Yeah.
just be careful not to send your original response until it's been amended. And Julie's kind of looked at me like a few times and gone, "You're not sending that, are you?" It's like, I find it quite therapeutic to kind
Very
of
much so. Yeah, it's like that, you know, writing the email in anger, but making sure you don't put anything in the who's it going to, just in case you inadvertently send it.
Yeah,
that's
absolutely
incredibly therapeutic, and then you can just delete it. And
I know, but it is again finding, you know, looking at ways that and compliance is a main one, you know, the same as the complaint handling. I find it's getting our team on board, helping them understand. You know, I also have this game called Band Lingo Bingo, you know, because the team can really get a bit of a laugh with it and get into it. Things that we say that could trigger people when we're handling a complaint, you know, and all these things are so much more relatable to our teams and much more easier to implement if we can have a bit of fun with it, to be honest.
I firmly believe that learning happens better in a slightly fun or in a fun environment, and having a little bit of humor injected, and also fun. The only thing you can't do that with is safeguarding, obviously, because that's just a exceptionally serious and horrendous thing. But everything else you can. I think, definitely.
I agree completely. One of the things that Gilly, and for those that I apologise, I've not introduced Gilly. He was here. I have a Gilly in my practice, who's our compliance officer Stubbs. You know, and we do, again, we joke about, not about Gilly, but you know, about some of the things that we have to do. You know, but at the end of the day, if Gilly says we're doing it, we're doing it. Because that's her job. One of the things we were talking about earlier this morning was 6 months ago we took on 2 apprentices. We've not done it for many years, but we felt it was the right time. We've got probably about 6 or 7 people that are all going to be having babies permanently for the next 5 years. So we need to bring some younger nurses through, and we can manage that at the moment. To the point where our 2 apprentices of 6 months are so self-sufficient. You know, at 3 or 4 months, they went solo. You know, we're big believers in they're doubled up until we know that.
Apprentice what are they?
Apprentice dental nurses.
Okay.
And you know, if you can put the work in, and then they become competent and efficient, not just competent, but blinking good to run a surgery, a difficult surgery. It's fantastic. And what they bring to practices is a reinforcement of quite a lot of the compliance tasks, because it's fresh to them, so they come in, you know, and it's really quite nice. But one of the things that, you know, we are considering now with the May looming and the end of, you know, the school year for the GCSE people is taking on actually another one, because the other two are so fantastic and no trouble whatsoever. We feel that we could manage one more, you know, and this obviously helps with the increase of salaries and national insurance and things like that. But we do need to be careful with these younger members of the team, don't we?
Yeah.
I know Gilly's very thorough with inductions and things like that. Is there anything that you feel we should be doing as extra precautions?
Yeah, absolutely. I mean, obviously they must have Hep B. They must have their Hep B jabs. You also need a DBS for them if they're working in the practice, unless they're going to be supervised every minute of every day, in which case then a risk assessment will suffice. And I think it depends really. How long is their tenure generally, or are these people staying on?
Our aim is to stay on.
Yeah. Yeah, absolutely.
You know,
And then they go into training then, do they? Formal
so
training?
the apprentice, ours start within, we're very lucky, we've got a wonderful college locally that does dental nurse training. I know some online providers, it can be a bit hit and miss and can take longer, but generally it's about 18 months to 2 years.
Yeah.
Gilly, how often do they go to college?
They go to college once a month.
Once a month.
But we have to allocate 20% of their
Yeah.
working week to their college studies.
Because obviously dental nurses must either be in training or trained on the register. So I'm just wondering how that works, you know, with an apprentice, you know, because presumably if they're an apprentice, they can then decide whether they do or don't like dental nursing. But so what do you do about making sure they're on a training program, a formal training?
We put them on a formal, it's non-negotiable.
Yes.
They need the formal training. I believe that it's been changing, chopping and changing a little bit over the last few years. One moment it was they have to be on a course within 6 months, but I believe it's actually changed that they can do it. I had a conversation with a course provider for another practice that I support, and they said as long as they are appropriately trained, as long as they are on a course within 2 years, that's acceptable. Now, it might be acceptable, but is it right?
I think probably not is the answer to that. I think that, you know, I've got kind of mixed feelings about this, because the dental nurse training now is really, really onerous, and the exams are really difficult. And it's very common that people fail them first time round, which is really demoralizing and demotivating. And so I think that the GDC is uncompromising on absolutely everything. And I think that you don't ever want to be in a position where you or the trainee is thinking, well, I'm not sure if I'm doing the right thing here. So I think getting them on a course as soon as possible is the right way to do it. Whether it is or isn't considered to be acceptable, I must say I didn't know that had changed to be on a course within 2 years. And I think your question is exactly right, Lisa. It may be acceptable, but is it right? And I would say probably not.
I think the circumstances for one of the practices that I support, this was a few months ago when they needed, you know, obviously the maths and English situation has changed again now, where it's up to the practice to decide if they have functional maths and skills, even if they've not got a so-called, you know, GCSE pass. And again, I think that's sensible, because we know there are lots of wonderful dental nurses that have really struggled to pass. And in particular in some of the practice that I support, you know, it's kind of they've struggled with the nursing because they're still trying to do the maths and English. So I feel that decision's been good. However, this particular dental nurse I was supporting also got pregnant. So she was doing a maths and English and struggling. She's actually from Poland as well, so there was barriers there. And she was also looking at doing her dental nurse course and being pregnant and having a very difficult pregnancy. So for me, I contacted the course providers and they said, do you know what? It's not appropriate circumstances. It wouldn't be right. So we obviously had to just make sure she was appropriately trained, and she is going to be doing it when she comes back off of maternity.
Yes, sure.
So there are circumstances where.
Yes, absolutely. And then, common sense really is the common sense and caring actually are the things that you need there. I think, I would agree with that, definitely.
Yeah, Julie, you've had discussions with the one apprentice that we've taken on, who she won't be starting until June, because she has her exams. She's able to have her Hep B
Once she's 16.
once she's 16. She's honestly makes you feel so old.
I know.
Goodness. And it's, you can't believe that, many of us started at
Yeah.
that point when we were just
absolutely, absolutely. And also, if you think back to some of the things that you did as a dental nurse in a very long time ago, and I think things have changed hugely. I mean, I'm personal opinion coming up here, I'm not in favor of making the dental nursing course so difficult that people who struggle to pass exams, whether it be maths, English, or whatever, simply can't do it, because it doesn't mean that they couldn't be great dental nurses. And I think it's wrong.
Yeah, I completely agree, and I feel like something needs to change with it, definitely. I know a lot of nurses who are doing an apprenticeship or a trainee, they struggle with getting the assessments done, the practical assessments done.
Yes,
which
absolutely,
really,
yeah.
But also, as an employer, many people have come to me as qualified nurses who we've had major cross-infection problems with.
Really? Yeah.
Like, to the point you then have to almost go, right, let's go back to basics. And then there's complete uproar because, well, I'm a qualified nurse. Why are you showing me? Why are you telling me I'm not doing that right? But I'm talking about basic dirty gloves, clean drawers. And it's,
how is that even possible when that's what they are? Presumably they're parroting what was taught to them on their course.
Yeah, and there's also a lot of practices that only have trainees.
Yeah, well, I think the recruitment situation is so difficult. We've had a trainee in our practice recently. My husband said that she's the best nurse he's ever worked with.
Brilliant.
And she's just gone traveling. She was covering maternity leave for his regular nurse, and who is now back, and but she's gone traveling for a few months, and he just is hoping and hoping and hoping that she comes back, because he said that by miles, she's 18 years old, by miles she was the best nurse he's ever worked with, and that's really saying something, actually.
You can really mould, some associates are a bit sniffy at having an apprentice or a trainee. And our principal here has always been of the mind, do you know what, you've got an opportunity to mold somebody into being exactly what you need and working really well together. One of our apprentices works with one of our dentists, and he's not a difficult person. I'll say that now, disclaimer. He's not a difficult person, Steve very well.
Yeah, absolutely
Lovely. But the work he does is difficult. He's not difficult, the work's difficult.
Yes, sure.
We've got nurses that have been with us, probably 15 years, that actually would have a heart sink moment if they saw themselves on that rota with him. But our apprentice, she just takes it in a stride. And he said, we can have the most awful morning. You know, we'll pop in the office and I'll say, was that a bad morning? He'll go, horrendous, as it, you know, as it can be sometimes. And he's like, do you know what? She's still smiling at the end of the morning.
Yeah,
He's not huffing and puffing and
that's
moaning.
fantastic.
And it does bring a different energy.
And so what is the definition of an apprentice in the dental nursing capacity?
So I believe an apprentice is somebody under 21.
Oh, okay.
Whereas, and you get different funding for it.
Oh, I see.
So in our area, I think it's about, you get paid, I don't know, I think it's a one-off payment of £1,000 to take an apprentice.
Okay.
Now, I will say, obviously, as an apprentice, you can pay apprentice salary, which at this point in time is £6.55.
Yeah.
Now, we always go at least, you know, a few quid above that because it's hard work. And actually, once we've hit 6 months with ours, we do recognise that as well because they're doing the same job as the others.
Yeah, exactly. Yeah.
And it's hard, like you say, it is hard. I do believe that from April, so from next week, I think it goes up to, for somebody under 18, I think it goes up to £7.55.
We need Sarah Buxton to tell us that.
I'm pretty sure.
I'm sure you're
yes,
right. Yeah.
Yes. I'm pretty sure. Obviously, check it.
Yeah. No, absolutely.
We always pay a little bit above that anyway.
Yeah.
I just think it's
that's really, really interesting. Really interesting. It'd be interesting to see actually whether anyone on this call has got trainees or apprentices. So let's ask the question: who on this call today has an apprentice? Just pop that into the chat if you have, and then please pop into okay, good. Okay, so it's clearly a few people do, and so who on this call has a trainee as opposed to an apprentice then? Okay. Okay. Yeah, and I think that's it's what people are doing because recruiting qualified nurses is so problematic and they're so hard to find. So that's really interesting.
I think it's getting better. I think I just feel that they do bring a different generation to the team.
Yes.
And it's really quite good. I think there need to be considerations about, you know, the age of these people because you know, you do feel, I think I'm just getting old, but you do feel a little bit, you know, I'm certainly not going to mother them, but you do feel more, you know, quite responsible.
Yeah, sure.
When they are, you know, so young. It's just me feeling old, I think, to be honest. But
no, well, but you're not old, Lisa. Yeah, I think so. And you know, maybe as a mother, you know, there's a bit of, you know, sort of wanting to be a bit maternalistic with them. But I think that if you think back to the old days, you know, people left school at 16 and were out working. So I think they don't need to be wrapped in cotton wool. I think they just need, you know, they just need to be treated as one of the team, and then, but then consideration given to the fact that they are young.
I think what I found, and please, ladies, if you've got anything to contribute, please do. But I think what I found is, you know, with our apprentices, we just need to we did need to kind of do a little bit of a life lesson, you know.
Yeah.
There was banter going on, and they'd sort of said something that to somebody that somebody else would have accepted from someone else, and it's like, you know, you do need to realize that they've not got life experience. So
no, it's kind of worse than that, though, isn't it? Because I think this much younger generation have, you know, and I know we're probably going to get into sort of into difficult waters here, but I think that they have very strong views on what is and isn't acceptable. And I think people from the much older generation won't necessarily understand that. And then I've seen older clinicians get themselves into a spot of bother by thinking that something is banter when the much younger generation, and actually at 16 they are still children in British law, will not see it as banter. And so I think you know, there need to be some quite strict behaviour rules in the practice around what is and isn't acceptable.
Yeah, I mean, our girls, we do birthdays, everyone gets a bottle of Prosecco kind of thing. And I know one of our apprentices, she was 17 a couple of weeks ago, and apparently, I didn't know this, but apparently she is obsessed with Greg's, the pasty
baker. The what? Yeah, the pasty shop. Yeah.
Yeah. So I'd actually bought a mug that said Little Miss Sausage Roll. You know, it was one of the Little Miss and Mr. Men type things. You know, because I'm sure she goes and has she'll have a drink at home with her parents and things like that. But we do still need to be and compliant.
I think so. Yeah. No, I think so. I do think so. Definitely. Oh, has Lisa disappeared? Oh no, Lisa, you're there. Yeah.
Oh,
yeah.
Sorry.
Yeah. Sorry, I thought you disappeared for a minute there. Lisa, shall we ask our audience if they've got anything they'd like us to talk about today, or any questions? Because last time we did this, we were inundated, and it would be nice to be inundated again. Has anybody got anything they'd like us to cover, or any particular questions or issues, or anything you want to raise, or comments you want to make? If not, Lisa and I will just keep gibbering together.
Gilly did mention earlier, by the way, about depending on your area, some new food regulations that have come in.
Yes, so very, very interesting thing that Gilly brought up, because in our area this has been a requirement for some time now, and it kind of ties in a little bit to HTM 0701, that is the safe and sustainable management of healthcare waste. But the point that Gilly made was not to do with healthcare waste, it was to do with general waste and the segregation of general waste. And I wrongly assumed that all parts of the country had to do this at the same time, but I think that is not the case. So depending on where your area is, and also depending on your views on everything we should be doing to protect the environment, then there is a requirement in our area to segregate food waste. So that is things like compostable type things, to separate it out into a little bucket, which in our area does get collected every week. And then of course, a requirement to segregate out recyclables, so glass, cardboard, paper, plastic, and then so that you actually end up with a really small amount of what I would call just general waste. And so Gilly was saying that this is really, in fact, only coming in your area as a requirement on the 31st of March. So I think probably the message to our audience today is just check what the requirements are in your area.
I think the question is about storage as well.
Well, yes, because we're going to have to find. Also, it does mention your waste collector as well.
Yes, yeah, and that's very variable. You know, if you're in Birmingham, you're not going to get your waste collected at all, are you? So I think it's probably quite difficult. So my advice would be, and hopefully Gillian, Lisa, you agree with this, would be to check with your local council what the requirements are.
Yeah, I know. I mean, you know, it's fine at home, isn't it? You know, but in a big, you know, we've got a team of 42.
Yes.
It's going to be, I'm sure, we're a greedy bunch, don't get me wrong. There's not much waste. A biscuit doesn't go. We don't have a biscuit that goes off. Most of us don't.
No.
But, you know, there is going to be waste.
Yeah.
And with 40 odd people a day, it's like, where do you store it?
Yeah, where do you store it, and where's it all going to go anyway when it, yeah, absolutely, yeah.
Well,
so I don't
yeah.
think it's going to be very easy at all, but I think the only thing to do is to check with your local council as to what the requirements are for workplaces.
Yeah. I think Pamela has a question for you, Pat.
Yes, okay, right, let me have a little look in the chat. So Pamela said, I'm a new manager, congratulations, and the owner has said that I have to complete the audits. Never done one, any advice? Great question. Thank you, Pamela, for asking that. I think the simple answer is complete them honestly. So and you're going to think that's a really weird thing to say. So I've run training days where the practice managers have been tearing their hair out because they've given to get delegated completing something like an infection control audit to a member of the team, and then questioned why everything was a tick on the audit as being correct and done absolutely as it should be, which isn't realistic. And when questioned, this person said, "Oh, well, I thought all I had to do was tick the boxes. I didn't realize it was something that if we didn't do it, I had to put that we weren't doing it." And if you're going to be doing audits from a regulatory perspective, then the regulators will not expect to see that everything is ticked as being yes. So let's say you're doing an infection control audit, then they will what they will expect to see, because it's more likely to be true, is that not everything is in place, but that you have a plan for rectifying anything you find that is not being done. So that's with an infection control audit. And that's probably the one that you do most often. There are then a lot of complicated audits that go with radiation protection. So I hope that you have a compliance system in your practice, because there should be some templates within your compliance system for doing the audits. If you don't have a compliance system, then I think it's difficult to know what audits you should be doing. I mean, okay, thank you, Pamela. So from an infection, no compliance system. So from an infection control perspective, then the IPS audit, the Infection Prevention Society audit, will suffice. My issue with it, though, is that they don't keep it up to date. Now, you could say, well, infection control is infection control. Why does it need to be kept up to date? Well, at Dentistry Compliance, during COVID, we completely changed our infection control audit to reflect everything you had to do in COVID. And then when COVID retreated into the background, we took it out. So we keep our infection control audit at Dentistry Compliance up to date all the time. Now, Pamela, I'm afraid it means you're going to have to either get a compliance system or do a huge amount of research on what audits are needed. In terms of how you complete them, though, it should have a question that you then answer yes or no to. Now, with the infection control audit, it should then give you a score as well. Now, the Infection Prevention Society audit does give you a score, and ours at Dentistry Compliance does too. Don't know what the other compliance systems do. Maybe they do at something similar. And then there'll be patient record audit. Now, patient record audit is really, this is quite a tricky one. My very strong personal belief is that clinicians should audit their own records, because if you, as a manager, audit the records and then go to a dentist and say, well, you haven't done this and you haven't done this and you haven't done this, they're just going to go, oh, well, you just picked a bad record there. So, and bearing in mind what the reason for doing a patient record audit is to protect the clinician. Really, the message I would always like to try and get over is to encourage the clinicians to do their own, and again, to be honest and not, you know, not just tick boxes for the sake of ticking them. And when we go into practices, we see a lot of audits that have just been done as a pointless tick box exercise. So they are, and they don't accurately represent what is happening in the practice. So Pamela, I'm hoping that within your practice you have some systems, even if you don't have a formal compliance system, as in one of the recognized compliance systems. So I'm presuming you have policies in the practice, and do you have any audit templates in your practice? Or are you going to have a few? Yeah, okie doke. Okay. Well, I would get started on those. I would also recommend that you think about with the principal, perhaps getting a compliance system. Lisa and Julie, have you got anything you want to add to that? Because you do the audits in your practice.
What we were saying about the aside from the audits, the organisation is key, isn't it? You know, to have a compliance system. And I know, obviously, Pat, you're from Dentistry Compliance, and it is a fantastic system. And we've moved over to you from somewhere else, and it shows that you have an effective practice, and you know, everything's in place. These systems don't make you compliant, but they help you with compliance, and you will save so much time if your principal will invest in one. And it's seriously, it's probably costs less than a hygiene appointment per month. That's, you know, if you want to quantify it, and it will do it for you. Let them do it for you, for your sanity, for your, you know, peace of mind. And actually it will save you hours and hours and hours of time from the wrong word, I always do the wrong words, bareback audits. We're a big fan of a bit of both. Yeah. Having a bit of both, but to have templates and things when you're new to it is such a good safety.
Yeah. It is, and unfortunately there are no free templates out there. Actually that's not true. Apart from the Infection Prevention Society audit, that is free, and it's a good starting point. But hopefully you do have a template for.
I would say, Pamela, get a demo. Speak to Ryan at Dentistry Compliance. He'll give you a fantastic demo. You know, show it to your principal. It's very unusual not to have anything. And as far as audits go, Julie,
I'd say there's so much, compliance is so broad now, and there's so many things we have to have in place, and things change all the time. You know, there's new updates for things, so actually not having a compliance system, I'd be really, really worried that you're probably not up to date with everything, because, you know,
yeah,
before the compliance systems, every week you'll get at least one update that something's changed a little bit. And if you're a practice manager, you've got so much more and such a lot of things going on as well.
I think taking on, and ladies, please correct me if you think I'm wrong on this, because this isn't meant to be a sales pitch from me, but I think that taking on a job as a new manager without a system in place is quite a big ask, because you've got so much to do that is your responsibility, and practice managers nearly always end up being responsible for the compliance. I mean, there are very few practices that, as Lisa puts it, have a jilly, where somebody is actually the compliance manager, but your practice is enormous, you know, with 42 members of the team, and that is essential, I'm sure. But I think it's a big ask for a practice manager to be doing this without a system.
I think in you know, my nearly 30 years, Pat, gosh, we've clocked up a lot between us, haven't we? I think there's, as a new manager, 2 areas where you really should be having some external support is compliance and HR. Because there are so many changes. Like Julie said, you know, nearly every week there's some update or other. I know as Adam, you know, we work with Buxton Coats a lot, and they are very good at keeping us and our members updated. However, you know, I wouldn't even attempt to do an employment contract. Like Pat said, there's no templates that will protect you unless you know it's been done right. And I think those 2 areas, and that is good management. It doesn't mean you're not a good manager that you have to have, you know, use external. That's actually being so such a good manager to recognize that those, you know, you've not been to university, I don't think so anyway, I certainly haven't, to do a law degree. You've not, you know, spent 30 odd years and become a compliance expert, you know, in infection prevention and all of this. And I think it's, you know, as a manager, it's about, you know, doing these things that are really, really important, but, you know, could be quite litigious. And actually, by having these systems and the support there, it allows you to do things like the business growth. So yes, you know, being compliant might not necessarily be your principal's idea of you building the diary and things like that, but if it's all taken care of, it makes you a great practice and a great team, and you know, you can be confident that you're doing, you know, providing a good service and safe service. So I would say a couple of areas, compliance and HR, where you really ought to be getting some sort of external support.
And Pamela, if your principal and you would like a demo, Lisa, would you be able to put Ryan's details into the chat, do you think, please? So Ryan is our man on the ground who can do a demo, no obligation whatsoever, and it's free. Just have a look and see what's out there, and don't just look at our system, look at other systems too.
I'm just trying to have a look. I'm not the most tech savvy.
I can probably tell you, actually, I can probably give you Ryan's phone number if you haven't got it to hand there.
I've got his calendar. I was trying to find his calendar link, but it's very
right, go for it. There's
no, I can't do it. I don't know how to get it off.
Zero point in me trying to do that.
I've got his number because I drive him on the wall.
Right. Let me see. So the chap you want to speak to at Dentistry Compliance is called Ryan.
I've got it here, Pat, if you want me to do it.
Yeah, please, if you wouldn't mind, that'd be great. Thank you.
Tell him Lisa and Pat sent you.
Oh, thank you, Sarah. Now, how's that for a testimonial? Sarah says, I have just started with Dentistry Compliance and it's changed my life. In what way, Sarah? That would be really great. Can you put his office number as well, Lisa, because he's on holiday this week. Let me give you that. So it's
don't tell him Lisa sent you then.
So it's 01923
01923
851 781. So that might not be his, actually the mobile number might not be his personal mobile. I
think that's his work. I don't think I've got his personal number. You wouldn't.
No. Good. Anyway, give Ryan a call. Oh yeah, so Sarah's. I fear everyone will. It made Sarah more organised, and she had a hard time convincing her boss. You see, I really like what you said, Lisa. Is that this is one hygiene appointment a month or less than the cost of one hygiene appointment per month. It's not. It's not a lot of money, and for the peace of mind and the help it gives you, I think it is really.
Yeah.
I can't see how it's very easy to run a practice without a system now. 20 years ago, 10 years ago, yes, not now though.
No, absolutely not. I wouldn't. Yeah, it's just making things much harder for yourself, and I just don't think we'd ever feel confident that we've got it exactly right. And I'm not saying that it makes you perfect. I'm not saying that, but it'll help you be organised, and it'll help you keep updated, and at least
it'll give you peace of mind as well, because it's our job to keep it up to date all the time. And if you don't have a system, how do you? One of my favorite compliance quotes that I trot out all the time is, the biggest problem with compliance is you don't know what you don't know. And so why not let somebody else tell you when things have been updated, and they get updated all the time. So I think see what you can do anyway, Pamela, and really hope we get to welcome you to dentistry compliance, and very good luck in your new job. So any other questions at all? Because we're 7 minutes off finishing. I just want to make sure everybody gets the opportunity to ask a question if they'd like to.
if you
Just thought of something else for Pamela, actually, because you'll be needing to do risk assessments as well. And again, without some guidance on how to do those, I think that will be quite a struggle.
Yeah, it's so easy to get wrong as well.
Yeah, I think it is. So I mean, our risk assessments have examples of what the sorts of things that you need to be thinking about. So it's a risk assessment template is just a blank one is very helpful indeed, but one that's had it completed with some things that you could think about, whether they're relevant to your practice or not. I think have you found that helpful, Gilly?
I have actually, yeah, especially when you're taking on our trainees.
Yes, yeah, absolutely, yeah.
And I think it comes down to it, isn't it? Risk assessments, it isn't a tick box exercise. It's actually and as you say, from a regulatory point of view, people are being inspected, and people are looking at these things, but also it's protecting you as a practice.
Yeah.
For me, risk assessments and things like that, it's going to hopefully be that safety net if we ever do get a HR problem. It just it's all connected, and it makes your practice good. Like you said, Pat, it's reassuring that you do things well. I did
I agree with that, Lisa. So I'm sorry, I hold that thought. There's just something I wanted to say, which is you see, I don't think you should do any of this stuff just for the regulators. I think you should do it for the reasons you've just said, and because it's the right thing to do. Doing an infection control audit is about making sure your patients and your team members are safe. It's not about satisfying the regulators. It will satisfy the regulators, but that's not the real reason you do it. You do it because you're trying to protect your patients and your team members.
I do just to add to that, Pat, is it's as important that when we do these, that we show what actions we've taken and what we've learned from it. So many times, like you say, it's just done, and it's like, well, that's not great. okay, we'll try and do better. Well, what are we going to do different to try and do better?
Yeah, you have to. That is from a regulatory perspective, that is absolutely everything. So yes, you've got an audit or you've got a risk assessment. It's shown that you need to do things. You need to do the things you need to do so that you are compliant. But then again, if you turn that on its head and say, you know, why do we need to do it? That isn't just for the regulators. It's because in an infection control audit, you're trying to prevent infection being transmitted. So if you don't act on your findings, let's say your infection control audit is horrendous and you've got a pile of stuff that isn't being done correctly, then that means patients are at risk. And so you have a professional and ethical responsibility to put those things right. But also, you know, to protect patients, but you need to actually do something about it. You know, what is a complete waste of time is an audit that is just a pointless tick box exercise, and there are no actions arising from it that have been sorted out. So yes, you're completely right. That is the most important bit of all.
Yeah, and you know, there can be a bit of free thinking, you know, okay, you've done that needs to be done once every 6 months, but if it's not great, you might want to do it every 3 months.
Yes, exactly.
You know? And it's actually showing that you're thinking about things and not just doing that tick box type of exercise when it comes to, you know, we're actually doing it because we want to be safe, and we can demonstrate that, you know, if something doesn't go well, we can show that we did everything to reduce that risk. So no one's going to be perfect. You'll never, don't beat yourself up, you know. Perfect, imperfect is okay as long as we know about it and we know what we know. Not don't know what we don't know.
No, exactly right. Exactly.
We have come up to the hour.
Yeah.
We've done it again. Waffled on. With this lovely bunch of ladies. If anyone thinks of anything and wants to ask, don't wait till next time. If you want to get in touch with us, get in touch with Sam. Please get in touch with Dentistry Compliance. And Pat. Ryan's on holiday at the minute though, but you can still
only till Monday though. Only till Monday, and there's somebody there to pick up the phone anyway. So
honestly, you'll be blown away by the difference this could make. You'll probably, I give you permission to have a tantrum, Pamela, on your clinician, on your principal if he doesn't let you have a tell him I'll come round.
Yeah, nobody wants that. Gosh.
Thank you so much, Pat. Thank you, Sam, from ADAM, for organising us again.
Thank you.
I know this is going to be going out to all the members that haven't been able to make it, but thank you to Sarah, Lindsay and Pam and Jackie for coming, because it's really nice to get together. We'd just be talking to ourselves otherwise.
I know.
And thank you to Gilly as well.
Definitely.
We always find stuff to talk about. But,
we do. Well, thank you for asking me. Always a pleasure, and really hoping it's been helpful.
Oh, thanks, Pat. I'll see you in May.
Yes, see you in May.
No, April.
Yeah. Okie doke. All right, great.
Bye. Thanks, everybody.
Bye, everyone.
Thank you.
Bye.
Bye.